everybody, I'd like to share with you some tips and ideas for choosing a plastic surgeon. It's an important decision. You're going to have to live with the results for a long time. So don't just ask your friends. Get informed, do some research, ask a bunch of questions, and remember, questions are part of the business. Everyone's willing to answer your questions. There's no silly questions, and you should feel comfortable with the decision you're going to make. So where do you get started? The first thing is that you should understand what your goals are. What procedures do you want to have done? And that will help you select the plastic surgeons to consider. The first thing you want to do is make sure that they're board certified. And has certain requirements for board certification that are specific to plastic surgery and not just general surgery. So you want to be sure that someone has had experience with the procedures that you're interested in. And also some surgeons specialize in, say, breast and body, and some are general, doing face and breast and other parts of the body. So you want to consider that as well. Another important decision early on is, where does the surgeon do the surgery? You know, what facility is it done at? And is the facility accredited? There's usually two choices, and one is a hospital, or sometimes some surgeons have their own surgery suite. And personally, I prefer the hospital, because if something happens, you're in the hospital and you're covered. You want to look at the anesthesiologist, and is it an anesthesiologist nurse, or is it a certified anesthesiologist? So those are things that I considered when I was looking for a plastic surgeon. So the fun part of all of this is looking at the before and after pictures. And the good thing is there's a lot of before and after pictures. The bad thing is there's a lot of before and after pictures. So there's so many to go through. So my suggestion would be that you look at before pictures where the people are very similar to yourself, so that the results that they're going to get are going to be similar to yours. You don't want to look at somebody that's a big age gap or starting point is very different than yours. You can look for pictures on the web, celebrities, models, just people in general that basically look like, you know, the outcome that you want. And I would recommend that you not focus on like one person, say like, oh, I want to look like Jennifer Aniston, you know, or a Pamela Anderson or something like that. Pick a range and say, you know, this is what I did. I said, well, if I'm in this ballpark, I'll be happy. And the reason for that is that when you get into surgery, the surgeon is going to make decisions based on what he sees, and you don't know that in advance, and so you have to be a little bit flexible. You should also talk to the surgeon and ask how many procedures that he's done for the specific procedure that you're interested in. And also you can ask for references from other patients. That's very useful, because if they've been through the whole process, they can describe that, but they can also describe the surgery, the recovery, and the results. So that's very useful, and I found that very, very enlightening. And the other point is, I always do this, and maybe everybody doesn't, but I like to use my intuition, my gut feeling, and that you could have all these great checklists and everything and have all these facts, but if something just doesn't feel right and you don't have a connection with that surgeon, then it's probably not a good idea. And anytime that I've talked to doctors and made decisions with doctors, I always have a connection with them. So I think that's something you should consider. I think the last thing you should look at is the entire team. So it's not just a surgeon working on your project, if you will. You have the hospital and anesthesiologist, as I mentioned before, but also the office staff. You know, these are people that you're going to be spending a lot of time with, talking on the phone, visiting during office visits. And, you know, it's important that you feel comfortable with them and that you feel respected and responsible. You know, it just makes it a lot more enjoyable when there's people that you consider almost friends working with you. And that's one of the things that attracted me to Dr. Pusti. His office staff was really great. And actually, they were ones that asked me questions about, did I have questions about this or that? So I've actually found that very useful. So bottom line is, take your time, get organized. You can find checklists online. That's just one way if you can't think of the questions to ask. But I'd recommend that you do research and answer some of your own questions. And the ones that aren't clear or questions you don't have answered, bring those to the office with you and you can ask those questions. So I hope these suggestions are helpful. Good luck, and I hope you have a great process. How's that?